Just giving my lovely plant a little spritz. Hi, I'm Dr. Murmurs, and I'll be assessing you today. I see that you have come in for a full cranial nerve examination. Okay. Now we have a full set of steps to go through today. We will begin with some vital signs. I prefer to do that, especially if you are somebody that has sustained an injury of some sort. Are you happy to proceed? Okay. We'll begin with taking all of the relevant details, including why you're here. Okay, so can you please confirm your name for me? Okay. And your date of birth? Okay. Can you confirm the first line of your address and your postcode? Yep. Right, that's what I have here for you. Okay, do you want to tell me about what happened? Okay, and who assessed you? The physio outside of pitch, okay. And they looked, did they check your pupils? Okay, one larger. Another. Were you sick at all? Okay. Indeed. Okay. And describe your sore head since for me. Any blurred vision, seeing stars in your vision, any black spots or like a curtain partially obscuring your vision. Okay. Alright, well, it certainly sounds like you do need a thorough examination here to determine whether there has been any adverse effects to your cranial nerves. And I'll talk you through each cranial nerve as well as we go through today's assessment. Can I just check medical history and medications? Do you have any medical history that I should be aware of? Anything at all? Okay, and medication that you're on? Indeed. Okay, that's fine. All right. So, let's begin with some vital signs. I'm going to listen to your heart rate. Alright. If you just lift your top up for me. Like so, thank you. I'm just going to place this here. looking about 65 beats per minute, rhythm normal. It's very good, it's important for us. Okay, now we're going to do your blood pressure. Is that okay with you? I do have the old-fashioned kit. A personal preference of mine. If you can just provide me with your left hand preferably. So just slip that through there. Okay. Shouldn't be too tight. I'm just going to place that on top there. I'll try that again. And one more time. All right. Very good. Yes, you're 120 over 80, which is ideal. Just going to take this off you. Thank you. All right. Yeah, I put buttermint tea today. It's very nice, helps you get through the day. Okay. Right, as I said, that was 120 over 80, so it was good. Blood pressure normal. Now we're going to begin with your cranial examination. The first nerve we're looking at is your olfactory nerve. This is responsible for your sense of smell. Have you noticed any changes in smell as of late? Okay. Well, I'm going to do what I consider to be a little fun test today. And I like to keep certain fragrances and aftershaves here on my desk, and we're going to go through each one, and I want you to see if you can pick out the type of scent or hints of other scents in these fragrances. It's a really good indicator. Some of them will be musky, some will be floral, some may even be sweet. So you don't need to pick out a specific note. I just want you to tell me what you can smell. Alright? Okay. Let's begin. The first one. Okay. If you just take a nice deep breath in. That's it. What can you smell? Okay. No, that's good. That's exactly right. It's a combination of a floral and sweet perfume. Okay, so floral. Perfect, yes. This is actually my favourite perfume. It is Solaris from Penhagelons. It is a divine. Alright, let's try a different type of scent now. Okay. What is this one? Just take a nice deep breath in. That's it. What do you smell? Okay. Yep. A bit more of a muskier scent. Absolutely, you're right. It's musky. This is Tom Ford Noir. So musky scent. See, I'm sure you didn't think coming to the doctor's office would be like this. It's a lot more fun than people think. But don't tell everybody that, because otherwise they'll all come. Alright. In this. So breathe in and out. Okay. What do you think? Alright. Yes. Very sweet. Of course. It is none other than Flower Bomb by Victor and Rolf. So very sweet. Alright. We have another one here. Just breathe in and out. It is slightly a stranger scent. How would you describe it? A combo. It is. It's a combination of musk and sweet. Indeed, well done. So this is Tom Ford's Velvet Orchid. These are unisex fragrances, so either for the man and woman, hence the musk and sweetness. And our final scent. This one. It's quite spicy. Spice and sweet. Indeed, this is a Christian Louboutin perfume. This one in particular is called Libby Charm. So spice and sweet. Alright, well done you. That was 5 out of 5, so I'm very happy there with your olfactory nerve. Okay. Now we are going to move on to cranial nerve number 2, which is your optic nerve. So there are quite a few different examinations that we're going to do. We're going to spend quite some time on your eyes, okay? Now, do you normally wear glasses? Okay. Okay, so we're going to first of all look at your pupil size and symmetry. I'm just going to shine this into your eyes. So just look directly so slight. I don't think that's anything to worry about, okay? So, we're going to do your acuity. So we're going to use a little Snellen chart. Good one here. We're going to cover each eye. And we're going to go, you got to go down this chart. And then I'm going to ask you to read a letter from this. Okay, and then I'm also going to test the colour of that one eye as well with a plate. Okay, so let us, I'm just going to move this out of the way. Okay, so I'm going to cover your left eye. I'm going to hold this up. Can you begin by reading the chart? So the top line. Yeah. And then, okay, next line. Next line. Okay, and the next one. Next one. Another one. And anything on the bottom line. Okay. Thank you. 2025. Right eye. Okay, let's see. Can you please, I'm going to cover this line. Can you read the bottom sentence of this? Okay. So right eye sentence complete. Okay, I'm going to do 2 of these. So please tell me the number you see in here. What number is that? And then what shape can you see in this? Okay. Alright, perfect. On to your left eye. So I'm just going to cover this. And I want you to read this chart now. So top line. Next one. Next one. Okay. Next line. Next line. Next line. Next line. And anything from the bottom line. Okay. Great. Okay. And then I'm going to get you to read. Okay, I'm going to cover this. What does the top sentence say? This. Okay, good. Okay. What number is this? Okay. And what shape is this? inattention. Okay, so you need to look at me, and I'm going to hold my fists right here. And you need to point by staying focused on me. Focus on my nose. You need to point at which fist is opening. Okay, so which? Okay, point to the fist opening. Okay, so you can see both here. Alright. Okay. Okay, very good. That's fine. Okay. Right. So I'm just checking what we're going to do here. Okay. So I'm going to close one eye. Okay. We're going to use the pen. And you need to focus on my eye. So I'm going to have one eye closed. And you're going to have one eye closed. Okay. And you need to focus on my open eye with your open eye. And you need to let me know when you can see this pen. Alright. So we're going to close this one. And I'm going to close mine as well. Okay. Tell me when you can see it. Okay. Try again. Okay. One more time. We're going to do the same with this eye. I'm going to cover this. I'm going to close my eye, focus on my open eye. Okay. Tell me when you can see the pen. Okay. Alright. So, I'm going to put the light on. I'm going to close your eye. Okay. We're going to close one. And then you are going to tell me. We're going to set it here. And you're going to tell me when you can no longer see the light in different directions, okay? So we're going to set this here. Okay. Okay. Next one, other eye. Alright. We're now going to look at reflexes with your eyes as well. So, I want you to focus behind me on the closed door. Okay. And then now focus on my finger. Okay. Focus on the closed door behind me. And then focus on my finger. And one more time. Focus on the door behind me. Now focus on my finger. Good. I want you, so we're going to put this on your nose. Okay, I'm going to put this hand right here. And you're going to focus far away, and I'm going to shine a light into each eye. I'm just going to see how your pupils react, okay? So focus far away, the door. Okay. Okay. Keep focusing. That's fine. We don't have afferent defect or efferent defect. Okay, we're going to do a swinging light test. So, I'm going to shine the light between your eyes and then see how they react. The pupils should react exactly the same, okay? So, good. Okay, and then I just need to do another little inspection, so I need you to now look up. So I can check the optic disc. Look down. Look to your left. Look to your right. Up. Down. Left. And right. Excellent. Okay. So that was the optic nerve. I do have now a little fun test for your optic nerve as well. I like to add these into my sessions. And I just want you to tell me what you can see in each of the images I pull out. There'll be 3 images, and I want you to describe, and we'll see if you could see anything that I could. Can be anything in the image at all. So here's the first one. What does this look like to you? So you may be able to see a strong man flexing his muscles, a pair of rams butting heads at the top of a scorpion, a lobster, shrimp or langoustine, or the fallopian tubes. Okay, let's try another. This one. What can you see? You may be able to see a mask, either tribal or Chinese, a dolly animal of sort, from Tigger, from Winnie the Pooh, or a silly happy sheep. Musicians playing jazz at Halloween or jamming at an underground K-rock and roll club. A pair of parrots looking away from each other. A pair of red poodles facing each other. A pair of faces sticking out black tongues or emitting black bile, looking away from one another. So, did you see any of them? Finally, we're going to go with this one. Have a good look. What can you see here? Could you see a jet plane taking off with a heat haze? Maybe the head of a duck-billed platypus, yellow and blue bill. 2 winged elephants, possibly babies. 2 fishes kissing. Or 2 ladies in high heels laughing at a cocktail party. Upside down. I definitely do not see that. But well done. This is a little game that I like to do to check that you are able to see the pictures well enough and be able to analyse them. So that was good. Okay. Now we're going to move on to your cranial nerve, number 3, 4, and 6, which is your oculomotor, trochlear, and abducens nerves. Alright. So we are going to do the H test. So you need to keep your head still. You need to keep your eyes open both wide. And I need you to follow my finger because I'm going to make the shape of a H. Okay. I'll try again. One more time. I'll go this time. Okay. Alright, they looked absolutely fine. So we're going to move on to cranial nerve number 5, which is your trigeminal nerve. So I want to first of all look at your temporalis and your masseter muscles, which are the muscles that line your jaw in terms of wastage. So if you just want to close your mouth and clench your teeth. So I'm just going to gently feel that side. Okay. And then this side. In terms of sensory, do you have any areas of pins and needles or numbness anywhere? Is that because maybe you're sitting in that position? We can have a look. So you're fit. Okay. So I want you to close your eyes. Okay. And I'm going to use this really soft cotton wool pad. And I'm going to test the sensation over your ophthalmic, maxillary, and mandibular distributions of your trigeminal nerve. So all over your face essentially. And I want you to tell me if you can feel it and if it feels the same on each side. Okay, so close your eyes for me. Okay. And just say yes if you feel it. me know when you can feel it. Okay? You need to clench your jaw again. Okay. And then I want you to move your jaw side by side against resistance. So, see how I swung my jaw? So I'm gonna push. Go against it. I want you to try and move your jaw. Yeah, to your left. Okay, that's it. Try that. Keep pushing. Okay. Let's try the other side. Move your jaw. Okay. That's fine. Okay. So close your eyes. I'm just going to check the reflex of your cornea. So, sorry, keep your eyes open. I'm just going to touch this at the very corner of your eye, okay, on this side. Really gently, as it just try not to blink. Okay, and the other side. Great. And I'm also going to do your other reflex, which is your knee. Okay. Yeah, just sit there onto the table. Okay. I'll do this one first. And your other one. Try again. There we go. Didn't quite have the right part the first time. Okay, so your two reflexes done. Alright, so we're now going to look at cranial nerve number 7, which is your facial nerve. So I'm just going to have a quick look at your facial symmetry. Alright. Now we're going to look at your motor nerves. So I want you to raise your eyebrows for me, right to the top of your head, as high as you can go. Okay. I want you to scrunch your eyes really tightly shut, and I'm going to try and pry them open. Okay. I want you to show your teeth. Yeah. Okay. I want you to puff out your cheeks. And I'm going to try and push that air out, okay? So, puff your cheeks, that's it. Okay. Alright. Okay. All good. Now we're going to look at cranial nerve number 8, which is your vestibulocochlear nerve, and it is responsible for hearing. Okay. So we're going to start with the rough hearing, which is, I want you to occlude one of your ears, so cover it, and I'm going to rub my index finger and thumb together. I'm going to move my hand from peripherally towards your ear, and I want you to tell me when you can hear it. Okay. Okay, so cover that ear. Okay. So. Okay. Try again. Weber's test. So we're going to use this tuning fork. We're going to twang the long ends. We're going to put it to the base of it on your forehead between your eyes. And we're going to find out if one ear hears it louder than the other. Okay. We're going to do this a few times. Okay. Did you hear it louder on any of the sides? Okay, try again. Okay. And one more time. Alright, now we are going to do the Rhine test. So we're going to use this tuning fork and we're going to twang the long ends. We're going to place them on your mastoid process. We'll do it 3 times for each ear. And you need to tell me when this sound stops. Once it stops there, we're going to put it beside your ear and see if you can hear it. So, we'll twang it again. So, we're going to twang it, put it on your mastoid process. You're going to tell me when you can no longer hear it. And then we're going to put it beside your ear. Okay. We're not going to twang it again, sorry. You should still be able to hear it beside your ear. If that makes sense, okay? So, put it this side. Okay. Tell me when that stops. Okay, now, can you hear it? Your ear? Okay. Try it again. Tell me when that stops. Okay, and then can you hear it now? Okay, and one more time. And your mastoid process. Your ear. Okay, perfect. We're going to do the other side now as well. Of course. So, let's go. Mastoid process. Okay. And now your ear. Okay, that's good. Next one. Mastoid process. And now your ear. Up. And one last one. Mastoid process. It's a little bit louder, this one. And then your ear. Great. So, brain's test. Okay. Now we're going to move on to cranial nerve number 9 and 10, which is your glossopharyngeal and your vagus nerve. I need to have a look at in your mouth. So I want to have a look at your palate and your uvula. So if you can open wide for me. Okay. Right. So symmetrical. Okay, now your speech. Can you just tell me who you are and where you're from? Okay. Can you cough for me? Okay. And swallow. If you could swallow, that'd be great. Great. We're also going to do your gag reflex, so I'm going to ask you to open your mouth. And I'm going to pop this in. Be uncomfortable, but we need to check. Okay, open your mouth wide. So, okay, pop this in. Okay, no, that's good. I'm happy with the glossopharyngeal and vagus. Okay, so we've just got two more to go before a quick upper and lower limb neurological examination. So I've got cranial nerve number 12, which is your hypoglossal nerve. So I actually now need to observe your tongue. So if you could just open your mouth. I'm just going to have a quick look. You don't need to do anything with it. Alright. Now I want you to stick out your tongue for me. Okay. Good. And then I want you to move side by side. Like that. Okay. Now I want you to press your tongue into your cheek and try and resist against me. So this side. Alright. And then the other side. And finally, cranial nerve number 11, which is your accessory nerve. So I want to look at your sternocleidomastoid and trapezius muscles. So, yeah, if you could just remove your tongue. Excellent. Okay, I now need you to turn your head from side to side against resistance. So if I put my hand there, okay, now try and turn your head to your left. Okay, try again. One more time. Alright, and the other side. Let's turn your head to your right. Okay. And again. Okay. And then I'm going to ask you to shrug your shoulders against resistance as well. This is for your traps. So I'm going to put my arms on your shoulders like this. Now you try and shrug them for me. Okay. One more. Okay. And another one. Okay. Great. Alright, so to complete this cranial nerve examination, I need to do a full upper and lower limb neurological exam. Now, I'm going to ask you to do some movements. I'm going to assess you while you do this. Okay, can you please raise your arms to the tops of your head, so up in the air for me? Okay, and slowly bring them back down. Okay. Alright, can you raise one arm? So your left arm. And down. And your right arm. And down. Okay. Can you twist your upper body from side to side like this? Okay. Can you rotate your shoulders? So So bring your arms. Let's do one at a time. So let's start with your left. Okay, and your right. Okay, could you stand up for me? Great. You've got no problems walking. Can you just walk from that side of the room to the other, please? Okay. Okay, can you lift your knee up? Your left knee. And then your right knee. Okay, yeah, you can sit back down. Okay, and can you rotate your ankles? Yeah, just your left and then your right. Okay, so I'm just going to now summarize this exam. Okay, so we did a full cranial nerve examination for you today based on the fact that you had a concussion due to a sports injury. Your heartbeat was normal and your blood pressure was normal. Your olfactory nerve was unaffected. We tested your optic nerve. All of your acuity, visual fields and reflexes were working as they should do. Your cranial nerves 3, 4 and 5 were all fine as well, along with your muscles around your jaw, so your masseter and temporalis muscles. There was no wastage there. Your facial nerve is intact, your facial symmetry is good. You were able to carry out the majority of those tasks without any issue at all, and were able to pay against the resistance. As we moved to your hearing was good. You could tell the difference between bone conduction and your hearing, so all of that was fine. You passed all of those tests. Your speech is fine, you could cough, swallow, no problem, and your reflexes are fine as well, and there was no issues with your tongue. I had no problems with your sternocleidomastoid muscle and your trapezius muscles, and you're able to carry out all of the assessments and the tasks that I asked you to. Do you have any questions for me? Yeah, well, if you feel sick, then do please go ahead and report it. I think at the moment everything looks fine, but you may have some after effects from the concussion. So if you do find that you have any other side effects like sickness, dizziness episodes, then absolutely please call your care provider and we can take another look. But at this point, I think your cranial nerves are working as they should, and I'm confident that you will be able to get over this concussion with no other problems. Alright, well, I hope you enjoy the rest of your day. I very much appreciate you coming in to see me